So now go through the leishmania tropica complex, which will cause old world cutaneous leishmaniasis. So the leishmania tropica complex, it's remember a complex, so it consists of leishmania tropica, leishmania major, and leishmania ethiopica. Okay, this will cause what we call old world cutaneous leishmaniasis. This same old world cutaneous leishmaniasis, also known as the oriental sore or daily bow and the Baghdadi bow or oxy Aleppo button. Take note of the oriental sore, daily bow, just know those two names for the cutaneous leishmaniasis. Okay. So, what is the habitat of the Leishmania tropica complex? It's going to be found again in the parasite is going to be found in the skin. Okay. The morphology, you cannot really distinguish them from those for Leishmania donovani. They are basically the same. The mast is found in the reticular endothelial system, specifically the macrophages of the skin. And then the promasgots will be present in the sandfly. So for the life cycle, it is similar to that of L. donovani, except for the vectors. So the Leishmania tropica, the remember for Leishmania donovani, which causes the visceral leishmaniasis, we said that the vector is the pre-bottomous species, which are of different types, Argentipine, Papaciti, and such. Okay, and then for Leishmania tropica, the the vectors here is phlebotomers, Sergenti, phlebotomers, Papatasi, and then Leishmania major is phlebotomers, Papatasi, and then Leishmania ethiopica is phlebotomers, Longipesi. In other words, the vector is still the same sandfly, but then you have got different uh, species. How Leishmania tropica is transmitted again is via direct contact. I mean a bite by sandfly, even direct contact, like if you come in contact with the leishmania itself, even man to man or animal to man can also happen when these mascots enter the body. Okay, so how does leishmania cause a problem? So on the life cycle, what is going to happen is that the same life cycle that we really described for leishmania donovani. Okay, you are bitten by a sandfly, it ingests the pro-mascots. The mascots enter the macrophages. In the macrophages, they convert to a mascot. A mascot multiply, break, and then release these mascots from the macrophages into other cells. And then once you are bitten by another sunfly will take up their mascot, which will convert into the pro-mascot, and then the pro-mascot again can actually be given to you when you are bitten again. So how the pathology happens, the incubation period again is 2 to 8 months. Okay. The pathology, a mascot form is found in the histiocyte. These are basically tissue cell. The macrophages, if they're found in the liver, we call them Kupffer cells. In the lungs, dust cells. Okay. In the bone, osteocytes. In the tissue, histiocytes. In the skin, we call them the Langerhans cells. So these macrophages in the skin, we call them histiocytes. I mean, in the tissues, those are the histiocytes. So that's where we're going to find the mastigot. Okay. So what happens that there's going to be an inflammatory granulomatous reaction with infiltration of lymphocytes and plasma cells. So once you are bitten by this parasite, I mean by the insect, there will be granulomatous reaction. There will be a reaction that will happen, and then there will be infiltration of lymphocytes and the antibodies to go to the area. So the lesion usually here is going to be papular followed by ulceration. Remember, this one is causing the cutaneous leishmaniasis. It's a skin disease. So we're going to have these papules after you are bitten, okay, which can heal in months or even up to years. It can leave a scar. So the clinical features of this leishmania tropica. So I've already talked about what which species can transmit, which species of the leishmania can actually transmit this leishmania tropica. Like the most important one is Prebotomus segenti. You need to know that one. So children in endemic areas are going to have what we call the oriental so or the daily boil, okay, which is a raised papule, which can grow into a nodule and later on it can become an ulcer. Okay, you can see this is a papule on the mouth, can grow into a nodule and then it can become an ulcer. You can see here the scar on the nose, okay, because of acute leishmaniasis. And you can see here the scars, okay, I mean the wounds that have been formed because of leishmania. Okay, so the lesions may be a single lesion or you can have multiple lesions, and the spread of this infection can actually happen in the lymph nodes. Okay, the lymph node can become palpable, meaning that this guy can actually spread in the lymph nodes. The ulcer is usually painless. Like if you have got an ulcer, it's normally painless, unless if you have got bacteria ending up growing on this ulcer. So they are usually called a satellite lesion. Okay, especially in Leishmania major and tropical infection. You can see the way this one is. Okay, that's known as a satellite lesion. The ulcer is usually dry and it will heal spontaneously in about a year. Okay, so again you can see this one. That's the satellite lesion. Old word leishmania, cutaneous leishmaniasis. Sometimes the same ulcer, you can have now infection of the ulcer because it's usually dry. But if it's infected by other bacteria, that now it becomes soft as this one is appearing. Okay. So zoonotic rural type causing most ulcers which are inflamed are often going to be caused by Leishmania major, like when the ulcer is actually moist, that can happen. The incubation period for leishmaniasis is less than 4 months. Okay. Remember I said the incubation period is actually between 2 to 80 months, but it can be less than that. Okay. So sometimes you can have the same cutaneous leishmaniasis, but it is diffuse, that is affecting near the entire body. The non-ulcerative and often diffuse lesions, these ones are caused by Leishmania ethiopica. The ethiopica is the one that will cause these diffuse lesions. Then they are normally not ulcers, okay? You can see they are not ulcers here, okay? And they are usually transmitted by Phlebotomus longipes for ethiopica. So this one is going to be characterized by a low humoral immunity like the white blood cells. So especially the T cells will really not be able to protect you. So the lesion can actually last for years to even the entire age. And it's very difficult to be able to treat. Okay. There's also what is known as leishmaniasis recidivans, which is a type of lesion that is seen in persons with high degree of cell-mediated immunity to the parasite. Like the cell-mediated, the T cells are really responding so strongly against the parasite. So the lesions are chronic with alternating periods of activity and healing. Okay, they become active, they heal, active, they heal. And the lesions will actually resemble those that are found in lupus, systemic lupus erythematosus, or even in TB. Specifically for TB, not the pulmonary TB, but there's what we call TB lip, lepre, which causes the leprosy. Okay, the parasites for here they're actually very scanty. Okay, and so the resmanin test is going to be so strongly positive here. Chemotherapy is not going to be very useful, like using these drugs that will go in the body to try to eliminate this parasite might not be really useful. Okay, but if you use local application like all the drugs that you can apply to the local area, those can be useful. You can see this is leishmania recidivans. You can see these lesions that can happen. Okay, and it's actually characterized by recrudescence of papules or nodules which previously healed and then they come back again. That's what we call recrudescence. Okay, so just to compare, eotropica, the vector is usually the phlebotomus, segenti, and the papacy. Okay, these ones will cause the visceral, the cutaneous leishmaniasis. Okay, L major, that's tropica. All these are actually causing the same tropica. They're all causing cutaneous leishmaniasis. But L tropica, you can see those are the vectors, Phlebotomus sageti and papacy. L major is Phlebotomus papacy. L ethiopica is Phlebotomus longipesi, which will cause a diffuse type of cutaneous leishmaniasis. Okay, the L major will cause a wet acute rural type of leishmaniasis. This one is wet, meaning that it looks soft like that, so it has been infected. And then it is acute, meaning that the ulcer starts within a small period of time. The L tropical will cause a dry ulcer, which is usually chronic, like after a long period of time. Okay. So for the diagnosis, again, you can do microscopy, and in microscopy you basically want to see the mast got inside the macrophages. You can do the any medium couch. You can culture this one. You culture basically the parasite. To culture is to really grow it so that you can identify it, and this is the medium that you use. The Leishman skin test is also an important test that you can do. Okay, so basically that is on the Leishmania tropica complex that causes this cutaneous leishmaniasis.